Good evening, everyone. Thank you very much for joining on this live Facebook chat. Today, we will be discussing on some different aspects of the medical issues related with COVID as it is there at present. And my aim will be to uh, clarify so many things which are not well understood about the infection and how are we going to live with this COVID infection in at least few months or maybe about a year and a half from now onwards, because the life is going to continue. And I would say that for us, our attempt should be come back to the normal life. But normal life does not mean the way we were living before, but with some modifications. And those modifications are not to be based on WhatsApp universities or the groups which are scaring and negative in their approach, but it should be based on the medical facts, scientific facts, what is available to the medical world today. I know many of you will always complain that we said something 2 months back and then we changed that to another viewpoints and then we change it again. So we cannot deny that this is coronavirus is a new virus and nobody really knows about it. So we cannot say that this is the way it is going to behave, though it is very good that we could sort of decode the sequencing of the virus very very early phase, and I would say almost in couple of days after the first infection took place, we were able to decode at least the virus structure, and a lot of things depended on that. And unfortunately, some of the countries got involved very early in this infection, and they had their own inputs to give us. And we also learned from the various scientists, virologists, and epidemiologists across the globe, because in our memory, at least in our generation and the generation which is present now, we can very clearly and uh, very surely say that this is something which the world has never seen. There were many wars, Iraq wars, Iran wars, all those wars, etc., were localized to that area with a little indirect impact to the other part of the world. But this infection has really impacted the whole world. Now, I would just like to, my basic presentation and discussion with you, and I would request you to send me some of the important questions, is to bring knowledge uh, and take away your fear factor by the knowledge of the subject and how we have understood till date, because of the various inputs from super specialties in various countries and the political decisions taken in the past by various countries, learning from our own experience. So that is what I think our aim should be, that knowledge should be what we should be really gaining, and the fear should become less and less. I would say that if the fear was 100 at the time when we started this lockdown, I think our fear should be almost touching to zero level, because the knowledge has taken and displaced fear with the facts about this disease. We all know, I would just say that it's a is a new virus, and here also I think a lot of confusion which has arrived, which has taken place, and which I see very frequently is we must understand that corona positive is different than the COVID disease. If somebody is corona 19 positive, it simply says that his RNA, he has got RNA, you know, the coronavirus RNA. He may not have any symptoms, he may not ever have any symptoms, and he may be able to overcome that disease, that positivity, I would say. So, if there is a coronavirus positive person, it does not mean that he is a person who is suffering from a disease. Of course, it's likely that he may be sort of able to spread it, but by and large, these are the persons who are they are the persons who are only positive for the testing, but it does not mean that they are suffering. If the person develops signs and symptoms of the viral infection, then it is known as COVID. COVID, very clearly, co means corona, V means virus, VI, D means disease. So COVID 19 means a disease produced by coronavirus. And it is not only the positivity, just a positivity does not mean the person is diseased. So that differentiation we should keep. Now, I will also like to discuss, because we all must have known, and also it has been sort of made to understand that our Max Hospital, Saket, East Block and West Block, has designated as a green hospital. And a word of caution and also understanding what is a green hospital. Green hospital, like Max Saket East and West Wing, that means that the hospital has taken there. First of all, there is no corona patient in that, neither in terms, at least known, neither the patient nor the doctor nor the staff. So that is one. Second is that it is a corona ready institution. That means that by chance, if like, first of all, the vigilance levels are very, very high. Anybody entering that hospital first is checked at the gate, and also made sure that he has got a good hand hygiene and also wearing a mask, and does not have any fever of symptoms like common cold, cough, and other things. So at the gate, there's a first point where the green hospital will check all those things. Second, we will make sure that the social distancing is maintained in the green hospital. That means the chairs will be placed separately, distantly, with a good distance of about 6 feet. The doctors will be all wearing the uh, uh, preventive and gears, which may include the visors, may include the N95 mask, which include the hand, very strong and very strict hand hygiene, this thing. And sometimes in some clinics, some OPD blocks, we have got the sort of acrylic sheets and glass sheets which separates the patient from the doctor. So that also is prevents, and this is more true when we are dealing with the common cold or the chest infections, or what we call is the clinic dedicated for that. Now, the cough and cold, if somebody is suffering, the clinic for that is entirely different. It is actually outside the building. There is a room close to the emergency room, which is totally separate, where they are screened for any symptom. So that makes a very strong in whatever physically, medically, and planning wise, whatever is possible. I think these green hospitals have made provision for possibly all those things, and after that only we declare it as a green hospital. Now, uh, from the patient's point of view, I would like to, in at least 2 3 months what have gone, we have been looking after the emergency patients. I, being a surgeon, I think I've been operating the cases in emergency. But what we have realized, yes, emergency means it has to be a genuine emergency. But at the same time, after we have become a green hospital, now we, after a long gap, we have to take care of lot of our patients. Like COVID patients are extra patients which needs to be handled by hospitals, as our smart hospital is dedicated completely to for the COVID. So everybody is trained for COVID management. So we cannot ignore the other diseases which were which are there. And in these 2 3 months, what we have seen, that a lot of our patients have ignored their existing diseases, existing surgical interventions which were required, and they sort of, out of just fear, they did not come. Maybe it's a justified fear, it's a justified panic reaction. Maybe we were trying to adjust psychologically, socially, mentally, and from the family point of view, our economical point of view, we were trying to see how can we adjust to the present condition. But as we all know that we cannot continue with this, and we will not let the diseases with which we are suffering from a routine disease, we would not like those diseases to create complications. And this is what my experience have been, that simple diseases which needed possibly a daycare sort of surgery, minimal access surgery, micro laparoscopies, and little intervening procedures could have made them very comfortable and prevented some of the complications which we have seen during this lockdown period. Because I think the lockdown period, even we become very handicapped. That means that we also have got limited resources, limited manpower because of lockdown. And, like we may not be able to handle the crucial emergencies which is arising in this situation. So, what I have been advocating and what I have been telling all our family, friends, and colleagues and patients as well, that there was a reasonable time, and this is the time when we should start paying attention to our pre-existing problems. We have come across quite a few cases of uh, gallbladder stone pancreatitis, uh, which had to go through that because they did not get operated for various obvious reasons. There some patients which could not travel from other places to come and get their diseases treated. Some cardiac patients who were having chest pain but because of fear and avoiding hospital. So yes, on principle, we all should avoid going to the hospital. But I would like to emphasize again that the green hospitals are those hospitals which are possibly maximally, we can say, as far as possible, are the safe hospitals to go for your problems, because extraordinary care is taken to make them green. Also, extraordinary cares are taken to sanitize the ward, to sanitize the rooms, sanitize the various unseen facilities like air conditioning, laminar flow, the operation theaters, the sanitization, which we were doing less frequently. Now we are doing it with each and every patient's visit. So I think in all way, whatever are the set norms and protocols set across the globe by national and international communities and the hospitals and other authorities, including the government, I think we have followed those as far as possible. Also, I would say that the diseases which were there in the past, those diseases are still there. If somebody has got a hernia problem, gallbladder problem, somebody has got a cardiac problem, hypertensive disease, and all those diseases, they are still there. So there is no disease which we can say that it's an optional disease. There's no optional disease. A person suffering from a disease is suffering from that disease, and that person might have delayed things a little bit, but now this is a time when we should address those diseases in the right manner, in the way they should be handled, and the way they were handled. Maybe we have to follow certain precautions because of the corona virus spread, which is there, and we all expect, and I'm sure there are a lot of predictions you must have gone across, that after the lockdown is over, I think there will be more and more patients who will develop COVID 19 disease, and they will be admitted in the hospital. So that also possibly may be a time when uh, the medical fraternity will be more busy handling them rather than the so-called routine work. So maybe this is also a sort of a period which is available where the number of COVID patients are not uh, too many. Uh, there are enough manpower. There is enough medical facilities. There are enough doctors which are available to sort out the curable diseases and curable problems and manage those problems in house. When you go to the hospital, I'm sure I would request all of you to follow the normal set protocols to prevent the spread and also to make sure that you don't get a disease, which is true whether you go to the hospital or you go to your office or you go to your working place or you go for your morning walks or you go to any place. I think those are the simple rules. What I would also like to insist that please try to understand that as a medical fraternity, as a medical personnel and paramedical staff, we all are under stress of also getting infected by the corona, apart from lot of protocols which we have to follow, which were not uh, required the pre-COVID era. So all of us, we are there. You as a patient, you as a family, you as the persons who need medical care also is under stress. Maybe it's a emotional stress, stress of the disease, stress of your family members getting acquiring the problems, also the economical burden which is there, which may be there in the family. So I think, but what I think you have to understand is we should respect mutual problems and respect each other for whatever possibly we can do. So we are also having problems and issues which are imposed by this virus, and you also have the same problems which is imposed by this virus. So we cannot sort of take offenses or take serious things on that. What we should concentrate at this time, that all the patients, the relatives, if the patient is coming, should not be accompanied by 10 people. He may come alone. He may be accompanied by at least one person, especially for the senior citizens and very young children. We expect one person. But I think you should follow. You should be wearing the mask. And mask is, I mean, I would not say that you are trying to cheat anybody. If you're not using the mask and if you're not using the mask properly, what is a proper mask? It should cover your nose, it should cover your mouth, and if possible, have your glasses also on, because these are the three surface: mouth, nose, and uh, your eyes. These are the surfaces from where the virus gets entry into your body. So you cannot stop breathing. You will continue breathing. You cannot stop looking. So if you protect your mouth, nose, and eyes, it's as simple as that. If you are able to protect that and you breathe the air which is filtered through those masks and you exhale your air filtered through that mask. So neither you will be in this manner, you will be inhaling a good air minus the particles and the virus and the bacteria, and you will be exhaling, even if you've got, say, so-called viral infection which is not manifested, then you will not be bringing out your virus outside to infect others. So this really helps. Many people we have seen and observed, and we keep on sort of telling them they wear the mask for the just to show that they are wearing a mask as a formality, which actually is not the right thing to sort of do. I think you should make sure that you are really wearing a mask with a purpose of not infecting others nor getting infected by others. Social distancing will do the same. And if you use the glasses, wear the glasses. like even if you wear a small protective glass, so your eyes are also protected. This way you are protected and very safe. So that fear of going to the hospital should not be based on the uh, wrong informations which you get from various sources. You should get the right information and take all these cares. Of course, you visit the hospital as less as possible, but if you have a disease which needs medical management and treatment, you must not delay it, because it is better to get the disease treated, cured, managed properly without wasting time, rather than getting into the complication of that disease, which can be much more disastrous, as we have seen in last a couple of weeks. We have been handling the patients which could have been handled very easily uh, on a pre-COVID time. Somebody delayed it because of examination, convenience of March, April, holidays, and things like that. And unfortunately, we feel very bad that those got into those complications which could not have been uh, expected. Also, you should have that confidence that the green hospitals like Max, Saket, East and West Block, they are almost, we can say, as far as possible 100% safe places to go. The doctor, the staff, they are almost 100% safe to deal with. And when I say 100, almost 100%, well, I think there are some seen or unseen things which are beyond human control. So those things, apart from that, I think we are very, very confident about the protocols which we follow, the the sanitization and the precautions which our staff takes. There may be some delay, there may be some sort of communication gaps, delayed communication gap, which should be understood at this particular time. And we all should follow the rules and regulations, also cooperate with the doctors and the medical staff. If there is a delay of couple of minutes, and you should just I wouldn't say ignore it, but accept it, because we also try our best to do. But I think in between the operations, I think much less time was taken before, but now we are taking very long time, because between every operation, with every patient's visit, we have to sanitize the place, which costs money, definitely, which we don't mind, because we have to make it as 100% close to 100% safe as possible. But at the same time, the gap increases. So between two consults, there will be a gap. There between two operations, we have to sanitize the whole operation theater complex again and again. So please understand the problems. Also understand that wearing a PPE is very, very difficult. It's a claustrophobic. If anyone has worn PPE, we must acknowledge. I know that how difficult it is to wear PPE. It takes time to for donning of PPE, and it's a claustrophobic to many persons which cannot wear it. The You cannot hear much. Sounds are difficult. Communication is very difficult. To recognize the person is very difficult. So we write either number or name of the doctor or the person who is working, because you may not be able to recognize that person. There's a lot of sweating with that. You cannot drink anything. You cannot have tea or coffee. You cannot go to the washroom. What I mean to say that wearing those PPE may look simple, maybe as you see the spacewalkers, but to wear it for hours and hours together, it's a very, very tremendous task. So we must understand that it takes a lot of courage and conviction and passion for the medical fraternity and the medical staff to wear that, and sort of, because we are uh, there on the front, so we cannot have an excuse not to be there. So we all are there, full heartedly we are there, but we would expect our patients and the families also to understand what we are going through, what the hospital administrations are going through, what the financial implications the hospital is going through, what the physical inconvenience and torture the patients, the doctors are not able to go after COVID duty to their families. So they are separated from the family. And after doing a week's job, even after doing couple of hours, they are sent back to the safe place like a hotel where they are taken care of. So that also is in a very expensive proposition, and keeping the medical and paramedical staff away from their family, and after a particular time they go back to the back to their family, and then they're quarantined in the family for 2 weeks. So 1 week of um, separation with the patients, they are there, and then they are separated into the hotel or another places. Then they work, come back again in a very um, uncomfortable mentally, physically, and they have to deal with the very critically ill patients. So I think those are the things. Also, I think patients, relatives are requested not to bring the food, not to bring too many things, not to bring relatives, and as far as possible, you can communicate with your near and dears by phone or video chats. So there are ways to do it. What we have to see is that we have to modify the way we have to look. Previously, I think one patient in the hospital, their visiting hours used to be filled with dozens and dozens of the relatives of one patient. Those things are now gone. I don't think it will be true tomorrow. I don't think it is going to be true in a couple of months at least. Then we develop the herd immunity. And what exactly is the herd immunity? Herd immunity is the patient who have gone through that COVID disease. Herd immunity will be acquired by those persons who carried the virus, and they've come over and they've got antibodies. And again, the major herd immunity is provided, will be provided for that matter, by vaccinations, which will take quite some time before it is available to all of us. So I think keep it in mind. Don't ignore your diseases. Don't suffer with the complications. Uh, Go to the green hospitals and treat, get the diseases treated, cured, and managed before it is too late, and there's complications surface up, and then it becomes very difficult and also very cumbersome and also very expensive to handle them from that. When our patients and relatives come, we say do not touch any surfaces, because keep your hands like this, don't touch unnecessarily things, the tabletops, the surfaces, various surfaces, which may be having the viral presence, or the presence of the viral protein, RNA protein. So avoid that, though we keep on periodically clean those surfaces, but still do not use the handles if possible. Use sanitizers as frequently as possible. Wash your hands as many times as you just think of. So I generally say that the moment you think that should I wash my hands or not, this is the time for you to wash hands, and open the doors with your elbows uh, while you are coughing, etc. Cough on the elbows rather than so wear genuinely wear the mask. Wash your masks frequently. Use many masks so that you have enough good quality and well cleaned mask. So this is what I have to possibly suggest. And once again, I would say that you should have the knowledge and not the fear. The more knowledge you have, less fear. So your knowledge will displace the element of fear, and will make you bold enough to understand the situation and follow the situation, maybe in the hospital, maybe in the family, maybe outside in your working place. And I will also insist that please do take care of your senior members of the family and young members of the family. Another problem which I've seen when we talk about the senior family, you go too close to them without wearing the mask. So don't go, talk to them from a distance of about 5 6 feet. Do not sort of hug them. Don't pamper them by touching them. Keep your wash when you enter their room. Wash your hands. Wear the mask. So this way we have to protect them for the coming time, because those are the patients we are at high risk patients, and also the outcome of COVID disease in them may not be very favorable in spite of prolonged hospitalization and other ventilatory and ICU supports. So this is what it is. I will be too happy to. Mm, yeah.
asymptomatic corona positive person can transmit corona?
Yeah, I think it's a question is that asymptomatic corona patient, can the person transmit? Potentially, yes, it can transmit. But my simple suggestion to all, but he's not a outcasted person. If somebody is corona positive, first of all, he's not a COVID patient. He's a corona positive patient, and he's not suffering from COVID disease, COVID 19. COVID 19 is a disease. Corona positivity is a simple fact that he has got virus. So his body must be fighting with those virus, taking care of that. His immune system must be good, his age must be favorable, and he may be in a good condition to face that. And ultimately, he will kill those viruses and will become, the antibodies will develop and immune. So I would say that don't look for corona positive or negative uh, persons. If somebody comes positive, you should seclude yourself in a separate room in your home. Don't meet everybody. Keep on wearing the mask. More so, consider that you are potential. You can harm somebody, and you don't want to harm anybody, including your family members. So follow that. But I would say that it is better for all of us. I think this is maybe a little different things which we have. I have at least spoken for the last 2 months. Consider that you have got a corona positive and take all the precautions. That means wear a proper mask, and I this thing. Don't touch your face. This way, even if you have got a disease, you will not transmit it to somebody. Why do you think that the next person who's coming close to you has got a disease? Think that you have got a disease and you're not going to go close to that person. So this is a positive way of looking at it. Creates a lot of positivity in you. You don't blame other person. You sort of take care of yourself. So we don't really know whether corona positive patients can potentially, yes, they can spread, but they are simply using mask and hand hygiene, and also not touching various thing. I think they are as good as anybody else.
Ajay Grover is asking, should we be insisting Arogya Setu app for all OPDs to build confidence that all greens are being addressed distinctly?
Well, I think Arogya Setu app has been found to be very useful. Something like that in China has been working. So anybody who's entering, they have to, show their telephone on that machine, which sort of, um, allows whether if they are green, they are allowed to go, and if they are red, they are not allowed to enter. So I think Arogya Setu is good app. I think all of must download it. Having said that, I think there are certain issues raised about the security and personal information. Theoretically, those things are always there. That is there with your PAN card, that is there with your Aadhaar card, your passport, everything is there. But I think in the present moment, as it stands today, Arogya Setu, I think, is a good way, provided you fill those informations correctly. Don't sort of, fill the wrong information. That information should be filled correctly and could be very sensitive and very reliable if your Bluetooth is on, and if your, location is on.
That's it. And Dr. Cook later says that.
Hi, John.
Okay.
So,
So I think let's.
so I will wind up with this.
Just a second.
Good. Yeah.
Aarti Marwa Luthra says, good evening, Dr. Chauve. This is Dr. Aarti Luthra, a practicing gynac. What are the guidelines for attending emergency cases? COVID negative cases can be treated as normal ones.
Yes, Dr. Aarti, thank you very much. I think it's very interesting because something which cannot be prevented and cannot be postponed and cannot be sort of deferred. I think the gynecologists have been possibly one of the greatest strength the medical fraternity had shown during this period, because they had no choice. The delivery, cesarean, and they were in the forefront. And it's a big salute to them, and big salute to our pediatricians and neonatologists who were attending the newly born babies. And I think, for medical point of view, I would say that today I think all doctors, where all the gynecologists for that matter, if it's in your specific case, you should consider it to be infected case, and you should have a complete PPE, and especially your anesthetist, etc. There are set guidelines we should be there, and we must follow. Whether the patient has got a COVID negative report, I think when it is a question of pregnancy, delivery, I think COVID positive, COVID negative, even the report has got no relevance. So I would suggest that the relevance is only from our point of view. We should prevent and protect ourselves and our medical staff, because if we get infected, 3 weeks the whole team is out of action, and that way we will be running, there will be a lot of patients and there will be no medical and paramedical staff to help them because they're all quarantined. So we should not let that stage come, and we should take full precautions while we are doing cesareans or handling such patients.
So Vesa says, is COVID-19 has related to skin diseases?
Not really. The COVID virus does not affect the skin as far as our knowledge goes today. It, as I said, it has got a special affinity for the respiratory system. And we know that our respiratory system starts from nose and mouth. But eyes also open, has got a mucosa there, and the cells are there. So they sometimes they settle down in eyes also. And because of this system, I think our face becomes one of the very important area. And it has been observed that normal person, any one of us, we touch at least 20 times our face every hour. So maybe, we do like this, we do like this, we do like this. Salman Khan will do like this, I suppose. So everybody has got a, tick. Somebody will do like this. I think it's a very common, and it's a nature. So to avoid that, if you this portion is covered, which is contaminated by virus, you're safe. If your hands have touched the face and you wash them, you are safe. So I don't think, if you understand, it's not that you don't read the newspaper. It's not correct. Read the newspaper, wash your hands, eat your breakfast. It doesn't matter. It's as good. They are safe. They are untouched technique used in printing. There are a lot of chemicals used in the newspaper. So they are fairly safe. I think a lot of studies have shown that.
How to identify the asymptomatic cases presenting as conjunctivitis or abdominal pain without fever and cough?
Well, there's no way to detect them unless we do a RT-PCR RNA test. I think there's no other way, because some people may have absolutely no symptoms at all. And today, I think it's more relevant for the ophthalmologists treating the eyes, ENT surgeons who are treating the ENT problems, and of course, the chest physicians who are dealing with flu and other related things. They have to be specially care, and also our anesthetist and our upper endoscopists. So because they produce aerosol, so they, that is very infectious. So those medical group of patients and surgeons should have to be much more careful. And if you really look at many of the medical professionals dealing with eye and this ENT and upper respiratory system and anesthetics, they unfortunately got the infection because possibly the adequate precautions were not taken. And I would also like to tell that I think a lot of WhatsApp universities teach that there's not enough PPE equipment. This is all false. Every green hospital, every place has got enough PPE, maybe enough for at least couple of months, if not for a couple of years. And there is a regular supply coming to us. So there is no question. Yes, definitely it costs money. But to all my medical and paramedical staff, we say that save yourself, because if you save yourself, then only you will be able to save the patients. If you are not safe and you are quarantined and you suffer from this disease, then who is going to train and treat the patients? And for corona infection and COVID infection, at the same time for their routine problems. If a gynecologist is not available, who is going to deliver or who is going to do a cesarean. So I think those practical, logical, reasonable things should be kept in mind. So thank you very much. I always feel obliged that you all participate and send me so many questions. And if something is there, you may always write to us. I will try my best to reply to all your questions. And maybe we will try to come back again after some time to try to update the knowledge, whatever little we know, and whatever knowledge we upgrade ourselves, the medical community, we will try to keep and replacing your fear with more and more knowledge about the disease as and when we come to know. So take care yourself, have a good proper mask, a good hand hygiene, and do not touch surfaces which are not required to be touched. Keep your seniors safe, keep away from them, keep your children safe, follow the government's norms and the medical norms which are prescribed from time to time. Read only the government notifications and the news published, which is authenticated news, and just keep what another way keep not only the social distancing but also distancing from the social media and our WhatsApp universities. Keep away. I'm sure you will find yourself with a lot of comfort and peace which comes from within. So thank you very much. Be safe.